What would happen if I just punched her in the face? Just talking about it right now, like my palms are sweating.
This is what we're doing.
And baby, they're not covering that. Bitch, it's a scam.
There should be no interest on student loans.
It's kind of bullshit.
People with degrees look down on people who don't have them. But I think there's now a nice, healthy chunk of people who have degrees who look at people without them and go, I wish I was fucking you. I wish I didn't
me, right here.
Well, let's calm you down here.
Agree to disagree's a fancy way of saying fuck you.
Is university a scam? Do we take mental health too seriously? Those are the two topics that I'm talking about today on Agree and Disagree with Kyle Brownrig. It's a huge pleasure to have Kyle Brownrig on the show. He's a Juno Award-winning comedian for Best Comedy Album, a regular at Just for Laughs, as well as other festivals like Halifax, Winnipeg. He's super funny. He's performed all over the world. I think he just got back from the UK. He's got albums out there. Go get them. But right now, he's here for you. But before I get to him, please subscribe to my channel on YouTube if you're watching. Follow the podcast on whatever podcast app you're watching it on and or listening to it on. And just, like, do the things, the ratings, the reviews, all that free support that I love. All right, let's get to Kyle. Okay, I'm here with Kyle Brownrig now. Kyle, thanks for jumping on the podcast today. I appreciate it.
Thank you for having me. How are you?
I'm very good, thanks. So I don't know if you've seen any of these episodes yet or seen some clips or whatever, but it's pretty straightforward. We agree on a topic. That's what we start with, because I think a conversation's good to start where you agree and then move to disagree, so you can always remember that at least you agreed on that one thing. I think it's a good way to stop, like, sometimes dumb fights. Like, even if it were over the holidays, if you, instead of fighting with that uncle, if you just line up where you agree on something, you can save yourself a lot of time. But I also realize that there are some uncles that are unsavable. So, all right. So the first topic that we have, and this one I picked specifically because you had written a note next to it saying that it directly affected you, which I thought would be good. That basically university and college has turned into a scam. I agree with that statement as well, although I would say obviously there are some things that you definitely want degrees for, and even some, maybe every degree matters, but there's too many people getting those degrees, and maybe we just need more on the job training, whatever, but we can get into that as we go. But this is something directly impacted you. Why do you think that they're a scam?
Well, to start, I live in Toronto, and I would say that any major metropolitan city in Canada would agree that every waiter, bartender, person that works in a nightclub that is probably one of the most overeducated individual with that degree that they will never be able to use, whether it be English, history, philosophy, sociology. There are so many impractical university degrees that people have that they simply just can't get a job in unless you pursue the route of academia and become a professor, which I find very incestuous. And just being in school for the rest of your life, that's really. But for me, I thought that it would be, this is also a little on me, that it would be a slam dunk to get a university degree in illustration, which is a form of visual art. I was streamlined into a very prestigious program that they only let in like 100 people a year. It takes years to get into. I got accepted right out of high school. And most of those people, when they're done, they get streamlined into like DreamWorks, Disney. So it's a very competitive, very difficult program. And for me, I'm such a pick-me girl. I'm like, oh, I'm special, I should do this, without actually really thinking, like, what are the job prospects for somebody with this type of specific education? And in my case, it's specific, but also people that, for example, have a degree like in psych or in philosophy. It's like, what are the job prospects for that? And the amount of thousands upon thousands of dollars that they spend on those educations that they can't eventually use. And then that's why they are my, waiter at Sneaky D's,
The philosophy is one you brought up there that I'm like, I can't believe that's still a fucking university class, like in a course and something you can major in. That should be banned, like from being able to be. It's not that philosophy is great, and I'm not saying there aren't good teachers of it. Maybe it could be a class, but it can't be a major. You can't major in it. You should be able to take, because philosophy is a good thing you can bring into your life. And there's also lots of philosophy you can just look up on your own on the internet nowadays, and you can still open your mind that way. But paying like fucking $6,000 or $7,000 a year for 4 years to become a philosophy major is reckless. It's the fact that we let it happen is reckless, I think.
But to me, a degree like uh, visual art or philosophy, it almost seems almost like I'm retired and I would like to expand my mind and I would like to learn and educate myself. I don't think I would what I know now pay all that money up front and study and look for higher education seeking employment in the world that we live in today, because it's just simply not applicable. Like the people that I went to school with, I would honestly say tops off the top of my head, like 5 people out of a whole graduating class are actually still in that industry.
Yeah. Yeah, I mean that's it's a very I mean, like I love how that's the first one you did. That's tough, and then you were like, I think I'll do comedy,
I know.
because it's just like another like fucking lottery that you're playing. You know, obviously you're very funny, but there's lots of very funny people out there who are in a. Actually, you're in a hotel room right now, aren't you? I can tell
No,
with the.
no,
No,
this is Shay Kyle. This is part of the Kyle Brownrig collection over
you know what
here.
it was? The wallpaper. I thought maybe it looked like
It's peel and stick wallpaper.
yeah.
I'm very crafty. This is the visual art, the design. Yeah, that's what you're
um
picking up on. This is what I got for my education.
But I think one of the main things too with you know, university degrees, diplomas, different things, it became it became like a lie that was told that everybody needs one because every job basically demands it. Like
Yeah.
it's at a point where being a manager of McDonald's, which isn't like, you know, I know it's not the job I'd want to have, but it's a job and you're working, you're making money, but you don't need a university degree or a diploma to do that. It's on the job training. You can learn how to do it. Like there's, and I think that there's a lot of jobs that sort of are in that level where you could work at McDonald's and then become a shift supervisor and then become the night manager and then, you know what, and then become a manager because you know how it works. I don't see what the 4 years of debt does. I personally think that's where a lot of, if we were just honest about that and we kind of change society around to stop pushing people into these diplomas that they don't need and say that stop telling people they need them. I don't know. That's kind of where my biggest sticking point with it.
Oh, I mean, I after I graduated, I worked in a call center, and they asked for if I had a university degree, and they wanted to they wanted to photocopy it to have it on their record as proof. I'm like, bitch, I'm answering calls being like, hi, what's wrong with your internet? I'll fix it for you. Like, why would I possibly need a visual art degree, university education for that? I mean,
Exactly.
like that's so stupid. I mean, but my boyfriend, so he works in medicine. You know, that's something that you actually need. You
Yeah.
know, the university there are certain jobs where you need that for, but I would say that there are just so many programs that are it's a scam. I for me, like my takeaway from doing illustration specifically, that program existed to keep the out of work artists, who are the professors, employed
Right.
and giving the students hope. And then it becomes that incestuous, like, oh, well, if you're lucky, then you can get a teaching position here at the school. And when I graduated, I was working as an illustrator. I did a lot of freelance work for the Globe and Mail, the National Post. I did specifically a lot of food and wine magazines. I don't know why that was my thing, but that was my thing. And somehow it paid less than comedy. Yeah, I
That's
know. Exactly.
yeah.
Yes. And the amount of work. There was one magazine cover that I did for this company out in out in Alberta. It was called Oil Week magazine. I have the cover somewhere, and it took me like 3 weeks to do this cover. I only got paid $1,000. 3 weeks of work for $1,000. Like that's just
Yeah, yeah.
it just doesn't make sense.
No. No. And it's one thing to be like, okay, I have to do this a little bit, but if there's no light at the end of the tunnel, and then you're looking back at the, student loan debt, if you had any, and whatever it is, you go, well, when is this going to pan out? At least with comedy, you know, you're just doing it. If it's, you start to get some more money, you get some more money. It's not like you're racked up a ton of debt, getting into it, unless whatever your lifestyle is while doing comedy. Some people rack up debt doing that, but at least it's not student loan debt. Um, well, this is another thing too. This is just an aside, almost a different topic, but not totally. Student loans in general. We talk about predatory loans like, credit cards and those fast cash places and different things. But I find like student loans predatory in the nature that they target like 17-year-olds at the end of high school by telling him you need to take this money to be able to go and get this thing that's not going to get you anything afterwards. And
Yeah.
then you pay the money back, but you're paying interest on it. There should be no interest on student loans. They're government money to try to educate the population. The money should be at least just lent and then paid back at dollar value. The fact that
Right.
it's like a profit thing to like get a fine arts degree and then be like, all right, I work at Sneaky D's or wherever. We'll use that as the go-to. Um,
But
like
it's like
that's
a
nuts.
bait and switch. They're being predatory on people's hopes and dreams and the optimism that they have of finding employment in their field. And like I was saying before, it's like there are fields like probably more like science degrees that actually you would
Yeah.
like engineering or
Engineering, yeah.
medicine or I don't know, that actually leads to stuff because you need that education. But like there's some of the silly degrees that we're talking about today, it's like, did you really be like telling kids to spend, like you're saying, thousands of dollars going into debt? I mean, I know people that were in my program that have only finished off paying their student loans recently. I'm 36 years old. We were in
Hmm.
school out of high school, or in university out of high school. And I think before what you were talking about when you said that there's such a sense of importance and a stress on people having post-secondary education for jobs like I don't know if McDonald's is one of them, but let's just say I personally think that's more of a generational thing from our parents who only had high school diplomas and they did not go to university or college, because I know that my mother did that in her 40s, and that was something that she was always very insecure about, but she had a great job. And she just walked in off the street, in the 1970s with a high school diploma, and she got a decent job, and she worked her way up the ladder. My dad went to university, but I think like much later. So I feel like a lot of that was more like a projection of insecurities of our parents' generation because they never had that opportunity. And as somebody that went through the system, I can honestly say having a degree did not help me, because let's be honest, having a degree in visual art, I don't care if you're the most talented person in the world, it's kind of bullshit.
Hmm. Well, and that's a good point. Like parents' generation, I think there is this idea that just having a high school education was bad. And it was true at the time because, like, when we were, I was growing up in the 90s, late 80s into the 90s, and at that point in time, you could still get a job with just a high school diploma and grow at that job and have a good job. But there was always going to be things like if you wanted to really advance, maybe then when you were 30, you went for to go get a master's in business, an MBA or whatever, or different business courses to like beef up your resume in case you wanted whatever. I think there was like the necessity for the diploma and the necessity for the degree faded, but the push to get it didn't, because it's now, as I said, if they're asking for it at jobs where they shouldn't be fucking asking for it. And it's just if we cut that part out, people would be like, nope, I don't really want to do anything that needs a degree. I can just do something else. Um, and there was a period, I think, where people with degrees, I'm not saying there are people who, this still, I'm sure, exists, obviously. People with degrees look down on people who don't have them. But I think there's now a nice, healthy chunk of people who have degrees who look at people without them and go, I wish I was fucking you. I wish I
Yeah, me
didn't
right
have,
here.
yeah,
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 right
I
here.
wish I
Yeah.
didn't have 40 grand or 50 grand in debt or whatever I have. I feel like I wasted my time. You don't have it, and you're doing, within the world we live in now, like, it just seems like Yeah, you're not going to be able to get it. Okay, so what do you think the biggest lie universities still tell students at this point in time?
I don't know if it would be a lie, but I think that what could fix or help the situation, I don't know if this is like a lie or of a withholding of the truth, but what if would it be less of a scam if they had to pay, for these kind of degrees where it's like, visual art, philosophy, whatever. What is it? Human kinetics, which is basically like a degree in gym. Um, uh, what if they had a disclaimer with the employment rate on the
Yeah,
application?
that's getting at a question that I actually have later on. Do you think they should have to just say, like, this is the percentage chance that you would get an actual job in this
Yeah,
field? Yeah. Yeah.
because in that sense of withholding that information, the lack of transparency, I think that's a lie.
Hmm.
Because I ran into a professor of mine at a hardware store, and I haven't seen him in years, and he was quite successful in the field, and he also was a gallerist and blah blah blah. And he no longer works there, and he literally said to me that that program was a waste of time. And when he said that to my face, I remember just being like, as a comedian, I think that's really funny. But as a person that spent thousands of dollars and had so much hope invested in that career path, it devastated me. So I think that even the professors know.
Yeah.
So I think there needs to be more transparency, and because there isn't, I think that is a form of lying.
Yeah, no, I think that's true. That totally, yeah, that's crazy that he just said it right to your face. He probably thought
Yep.
he was being cool and a little like
Yes.
honest or whatever. And inside you're like, fuck you.
Yes. Yep. 100% word for word. Yep.
um, do you think there's a part of college life that's valuable? Obviously there is. I think that's, but do you think there's any part of it that outweighs this, like debt? Like, it's good for socializing for some people. You do meet, like, I met lifelong friends in college. There are aspects of that maybe are, is it worth it just because of that?
Well, I grew up very sheltered.
Okay.
I grew up in a bubble. I always say that I come from a very privileged life, and I think when people hear that, they think like money. I came from the definition of middle class. It's like we weren't rich, but we were not poor. Um, I'll admit my parents paid for my tuition.
Hmm.
Not a lot of people are in that situation. I didn't have student loans. I'll admit that. But the thing that I found so beneficial that I think most people find, because I moved away. I was in Oakville when I was going to school, coming from Ottawa. I was forced to do my own groceries, clean my own apartment, be responsible for myself. And if my roommate couldn't do something, like I'd have to pick up the slack. I didn't have anybody to take care of me. And um, also making a lot of really stupid mistakes with yeah, in social aspects and stuff like that. I never have been like the cool kid or the popular kid, and uh I think that those kinds of experiences are invaluable. I also think meeting like-minded people, especially coming from high school, like I hated everybody that I went to high school with. They weren't bad people. It's just I had nothing in common with them. I used to have a locker that was in the janitor's hallway because it was the closest exit to the school. So the second the
Hmm.
school was done, I just fucked off and I went home, and I didn't want to be there. And I think being around like-minded people, because you are all like, I want to do this. I think
Hmm.
that also helps. And I also think seeing like-minded people, but maybe having different points of view. See, those kinds of things I think are so important, because a lot of my family never had that experience. And if I'm being honest with you, they're still kind of stuck in the 90s.
Yeah. 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 I agree. I do think, I think there's some value in it, but I don't think it's fully outweighed by, I think it's person to person. Like, if you're $60,000 in debt and don't actually use your degree, I think that it's, you might look back and go, yeah, I still have some friends from there, and there was a couple cool experiences, and I learned how to be an adult. but I probably would have done most of those things anyway, and
Yeah,
I don't
right.
need this debt. Whereas that's why it's like, if they could drop the tuition rates, maybe have, as I say, no interest on your student loans, and maybe more bursary programs of money that you don't have to pay back to take the sting out of the tuition, and you come at a 4-year degree $12,000 in debt, or 15 or something manageable that you can kind of live with. You can go, yeah, that was still worth it. Like I'm pivoting now into something else or whatever, but it was still, there's some worthwhile experience. It's the amount of money can really make that not worth it. So I'll do 2 more questions on this before we move to the next topic. If universities had to refund for useless degrees, which programs do you think would go bankrupt first? And I know visual arts is probably on top of your mind here, but let's say something other than that.
I think psych. I think psychology, because I know so many girls and gays that have gone into psych right after school because they find the understanding of the human mind very interesting, but not actually maybe understanding that like it is a form of science, and it is just as boring as regular science, and to have a practice, to write a thesis, to have to, find your patient so fascinating, almost like an experiment. It's like, I don't think a lot of people make that connection
Right.
whenever
They
they
just
take
think they're like, I give good advice to my friends, after a
Yes,
couple of drinks, and
yes.
they think like, yeah,
Yeah,
let's.
exactly. I think that would be the one that would go bankrupt first, because I know so many people that have undergrads in psych, and then oftentimes they get their masters in teaching, and then they become some sort of a teacher, or they get their masters in something just completely different. A lot of them pivot to I don't pharmaceuticals, or to medicine, or to engineering, and then they just have to like get some prerequisite courses. Like my sister right now, so she's in her 40s. She has 4 kids, and she's going to school right now for nursing.
Okay. Yeah.
See, that's a program that you actually have to, go to school for, to get that education.
Hmm.
Um, but I don't know if you've ever been to a hospital before. I would never want to be a nurse. It seems like it fucking sucks.
Yeah.
Because
I
they
can't
do all
deal
the
with
work.
blood or bodily fluids. It eliminates me from so many of those types of jobs. Like,
I used to have a joke about this where a nurse was like, "Well, can you handle blood and vomit?" And I'm like, "Yeah. Like I have a membership to the YMCA. Like deal with it every day." But no, I would say psych, philosophy is
philosophy
gotta
is the
be up
one for
there.
me. It's just I just feel like it's the one where there is nothing out. Like psych, if you go the distance and you actually learn it, and I think you're right though. I think a lot of people take it thinking it's going to be something different than it is. I think philosophy, it's like, even if you know exactly what it is, and you're just gonna get your master's, get your bachelor of education afterwards, and teach it. And teaching philosophy, I get it. The idea of philosophy on the cool university campus, and your teacher takes you out to the field to do a philosophy class that day, or what, and he's the cool guy who smokes weed, and oh, that's awesome. It's like, yeah, but that's his life. He just talks about philosophy all the time, and he's a university professor, and we don't need that many philosophy professors. So,
Yeah.
like, you're finite. You're not. I've never met a professional philosopher. Like, there are
No.
people who do other things. Like, if you look at like big personalities that are like have podcasts now, like Sam Harris is a guy that I listen to a lot, but he's a neuroscientist who then wrote books on that and different other subjects, and he has philosophy within what he does.
Right.
But
Well,
it's like something you add to other things. It's something you pepper in. It's not something you just are.
yeah, well, Steve Martin has a degree famously in philosophy.
Oh yeah.
I read his book, and that was a big part of, I think, as stand-ups, I think that is philosophy is part of the job, where we have to ask a question like, why is something hard, weird, stupid, or scary? And we examine like why something is silly. That's kind of a form of philosophy.
Mhm.
But like you're saying, would you go to $60,000 into debt so that you can apply that to
Yeah.
your bit, to
Or
your
read a couple books on it, and watch some YouTube
uh
videos, and just experience life, and then grow. It's not like I don't understand it, but like, it's just yeah, I don't see it being like I'm gonna major in philosophy for 4 years and then
Yeah.
you know what happens.
Dot dot dot. Yeah.
Yeah. What do you think a non-scam version of higher education would actually look like? I think I kind of cover what I said. No interest on student loans, more bursaries, find a way to force tuition to be lower. And that way, some people can go and do it to figure themselves out and have some experiences, but they're not going to be fucked. And then you can have a degree like philosophy and not be that much in debt. That's where I would say that's what the best version of it looks like.
I feel like I mentioned before, the transparency of the employment rate as a disclaimer
Yeah.
before they apply. I think that would really put things in perspective of like, this is what you can do. This is where you can work. Um, because if you were to ask my graduating class, I mean, for God's sakes, I was, what's that comedy club? It doesn't exist anymore, but it was Showtime in St. Catharines.
Oh yeah, that's gone, is it? I thought they changed the name and it's something else, but is it just gone?
Spotlight. It's changed to Spotlight now.
Yeah, yeah.
So the last time that I was there, I was walking in and there was this girl that I went to school with, and she was a couple doors down. She was working. She's a waitress.
Hmm.
I think if they polled students or alumni, sorry, if they polled alumni 5, 10 years after they have the degree and find out like what they're doing and had that information, that transparency, I think that would help. To be honest with you, apparently asking my professors would also be just as, helpful, because he was quite honest with me saying that the program was quite useless. But I mean, I don't think they would answer that honestly, because they want to keep their jobs. But
That's the other thing too. Colleges, universities, they're businesses now, which is another thing we maybe stop looking at it as much as a business, as a commodity, as opposed to this is, education's good for people if that's how you want to treat it. But it's obviously the profit incentives there. So when you get the pamphlet for the college, it's not like there's anything real in it. There should be like a video after you're like, okay, I'm going to apply for philosophy. And they should show you a video with people like, yeah, I became a philosophy professor. I enjoy it. I really love my life. People are like, the classes were fun. I met my husband there. And then one person going, I spent too much fucking money doing this. It was a waste of my time. Don't
Yeah.
do it. Like mix in the people. Like,
I agree. Yeah, like Speaker's Corner, but like for that's
Yeah.
funny. Like a confession booth. That's very
Yeah.
funny.
Don't.
That's very true.
All right, let's go on to this next topic. This is the one where we disagree. We take mental health too seriously. I agree with that statement. You disagree. With all of these, there is a caveat. I don't think that we shouldn't care about mental health at all. I think that mental health is very important. I actually have a bit where I talk about how it's good that we've started caring about mental health. I think that things overcorrect. I think that's the main issue. Although I think we have a absolutely tragic mental health problem in the city of Toronto right now, and I think most major cities look like that. I think that's the mental health we really need to care about. I think if I'm talking about mental health, I think there's a little bit too much rope being given to people to kind of use it as an excuse to justify some pretty shitty behavior. And a lot of it ends up being self-diagnosed as well, because there's enough articles out there that you can read where you go, well, that sounds like me, like all that'll be good. There's enough people doing that. So that's where my caveat would be. But let's see, let's hash this out.
Well, to what you said, I think that back in the day, everybody was like, oh, like everybody's gay now, everybody's bisexual now, everybody's now. Now everybody's autistic.
Yeah.
And everybody's saying that they're on the spectrum, and that's kind of the new thing. And you're like, well, who did you hear that from? It's like from your own head, because my father is on the spectrum. My nephew is on the spectrum. He goes to like a special school. It's a rich tapestry. It's very complicated, but like you're saying, okay, so mental health, are we taking it too seriously? Sometimes I think that we are taking it too seriously, in that I think people are coddled a lot and kind of babied, because they're like, well, I feel that what you're doing or saying is making me feel anxious, unsafe, and blah, blah, blah. Those feelings are perfectly valid, but that's also the human experience. For some people, it's turned up. I personally have OCD and I have general anxiety disorder, and I don't take medication for it anymore because it has always just made me feel a different kind of crazy.
Yeah, no, I've
Um,
heard that about some of the different medications for things. Like it can make you feel enough not like yourself that it's not something you really want to take. Yeah.
but sometimes my anxiety, my depression, my thoughts on something, I'm like having like a manic moment, and I don't necessarily think that everything that I say whenever I'm like having that freak out should be taken too seriously because I am just having a meltdown. And
Hmm.
that's what I mean by you shouldn't take too much, because I've had a lot of friends that are like super like just mentally not well. And
I know we're both stand-up comics. Yep.
yeah, and I've been friends with some of the craziest people, Shanty RIP. And when you're friends
I was
with
wondering. I was wondering if you were going to say the name. Uh,
you know and so with those kinds of things is that sometimes maybe because they're feeling a certain way, um does that mean that we have to validate every single thing and give in to everything that they want? Or do we only kind of take it at with a grain of salt and treat them with respect and respect their boundaries, but also kind of maybe, I don't know, not take everything too
yeah.
seriously? Because I think there's a line there, because I'm speaking as a crazy person, and I know for a fact that I look back on shit that I said and I'm like, oh yeah, that was just me being crazy.
Right. Well, and I've seen people like, I think one of the worst things for it is social media where people can show and this is where people kind of diagnose themselves with a thing and say, look, I have this thing and you have to deal with it. There always is this. I find the thing that comes up behind it is, look, none of the reasons why my life is fucked are my fault. I have this thing and you guys all kind of have to deal with it. If you're going to be my friend or around me, it's on you to accept the fact that this is who I am. And I've seen people make many posts like that. That's where I think it's like, look, you got your thing. Maybe if somebody really does have like a real thing and it's definitely like obvious to see they've been diagnosed, they're on medication, you give that person like a little slack, you don't, but also it comes time where, yeah, I mean, maybe I don't want to hang out with this person anymore. And that's looked at as being bad. But it's like, no, look, there's just a little too much. And I understand it's medical, but like, we can't just, there's a thing that I think people don't realize. It's mental health issues exist in the city. If you want to go with the most extreme cases of like people on the street because of mental health problems, that exists. It's tragic. I always feel bad for people when I see them talking to themselves and clearly they don't have anybody in their life to help them get over this, and we don't have enough social programs to help them get over this. But we have to accept the fact that it is the reason why they don't have anybody in their life isn't always simply because everybody just said, "Oh, I don't care. You're whatever. You're crazy and I don't like you." It's they tried for fucking years
Yeah.
and they could not get this person in the right because the mental health issues like that are at this point in time not solved and still look to be unsolvable until they get some magic thing that makes schizophrenia go away, because that's the one that tears people apart. You get it in your late teens, early 20s, and your life is fucked. And the medications for it are lobotomizing. It makes people feel not like a human being to take it, but it does make them not hear the voices anymore. So yeah, I feel like there's so much going on with it in society. I think that sometimes people will go, well, no, you just have to put up with this because this person has this. Andrew Yang said a great thing when he was running for mayor in New York. People talking about, no, we have to be sympathetic with people with, mental health issues on the streets. And he basically said, yeah, we do. But we also have to be sympathetic to the woman walking her child who's fucking terrified of this guy that no one is taking care of and no one is doing anything about. Like, we
Oh
have to,
yeah.
and that's what I think is like where we draw this line of like, it's not a get out of jail free card. It's not a thing that makes you completely invulnerable to criticism. I think society needs to do better. I think hopefully medical science will do better at some point in time. But there is that reality on the street that some of these people, there was a guy in my neighborhood walking around and he specifically targeted women. He walked down the street muttering to himself. And then if a woman came up by herself, he would get right in her face and start screaming. And I'm like, that woman shouldn't have to deal with this. Like, she should be
Yeah.
able to walk down the street and not be like, oh, I might die in 2 seconds.
Yeah, well, I mean, my neighborhood, we have a community outreach center, the 519. It's also a safe injection site. They do a lot of like harm reduction, fentanyl testing kits, and you know, basically overdose kits. That's all kind of in my neighborhood, and we have a lot of the people that you're kind of describing, and I've
Yeah, I've
also
got 2 halfway houses down the street here, and so we get a lot of different things too. Sorry, go ahead.
No, yeah, no, well, I mean, that's that's just like it's such a like a major big city thing, um, and like if you're not, if, I'm from the suburbs, like I said, I come from a very like a little bubble. When you move to the city, it's like kind of holy shit, like it's very jarring, But that's just very much a part of it. When I was over in London a few months ago, you don't see any unhoused, homeless, whatever people because there's so much social housing and social programs that take care of these people. And I remember just being on the tube or walking around and I'm just thinking like, where are all your homeless people? Like what did you do with them? Like you're almost like what, like, but it's in that particular case, that is a system that obviously works for them. Where I disagree, not so much about unhoused people because that's a very unfortunate situation, but I have seen so many people in my life. This is just personal experience. So many people in my life weaponize their mental health and form friendships and alliances with groups of people in a way where it's like, if you're not with me, you're against me kind of thing. And I have seen just toxic relationships, and it's all kind of based in the identity of their mental health, because if they do or say something wrong, they can use the excuse of, well, I'm borderline, or, well, I have this. And listen, I mean, I'm sympathetic to that. Again, like, I'm fucking crazy as well. I'm a comic, and like I said, I have OCD, I have anxiety. It's like, I'm not saying this from a completely ignorant point of view, but I am just saying that sometimes we coddle people, and as a result, they kind of, I don't know, make that their whole identity, and then it becomes like a crutch. I'm not saying everybody, but I'm saying that this is a thing. I'm just saying that if we constantly are just like, oh, okay, and just give everybody a pass all the time, I think that you're just going to create monsters because they can just get out of jail free all the time, as I have seen personally so many times, because I tend to gravitate towards the craziest person in the room. I really do.
No, I think that's like kind of the nail on the head. That's the perfect thing, is like people take solace in, the relationships, whether those are in person or online relationships, finding, Reddit groups or different things that they can kind of be like, oh, we all have this thing and we talk about it, we support each other and whatever. Not that that is inherently bad, but I think the problem is that we stop thinking that your mental health issue, even though it's not something you chose to have, it's also not something you can totally just get rid of, but it still falls under the umbrella of your responsibility. Like,
Yes.
you have to be able to put up with the fact that some people don't fucking care if you have anxiety, or don't fucking care if you're neurodivergent. They just don't. And like, the world isn't going to change to be around that. And the more you say to people, no, you're this, you don't have to worry, you don't have to change, you don't have to fix it. Like, that's, again, it's monsters, and it does a disservice to the person for the rest of their life. Like,
Yeah.
this is a way offside tangent, but there's like debate about like, if, how people were getting deaf people will go to, they were getting those implants that could make them hear, and they weren't that good, but they're sort of getting better. There's a whole fucking movie about it, The Sound of Metal. And
Oh,
It's
is that what it's about? I never saw that movie.
Yeah, so it's about a guy who goes,
He's
he's
like a
a
drummer.
heavy metal drummer, and he goes deaf. Just all of a sudden, it's just he can't fucking hear anymore. And he wants to get this back so he can get his hearing back. And there is this like pushback from the deaf community that he's dealing with that no, you're not broken. You actually can just do this. And I live a very productive life, which is 100% true. But if you could cure deafness, if you could make sure that your child was not going to be born deaf, if there's like, he's deaf, we can do that, we can read that now. We can just give him this thing and it'll make him not deaf. There are deaf people that would be like, well, that's insulting. We're people. And it's like, yeah, I get it. No one's saying you're not people, but obviously it's better to not be deaf. Like,
Yeah,
like
right. Yes, yes.
deaf people get hit by buses more because
Yeah,
they can't
sure.
fucking hear them. It
Right.
just hurt. So I feel like it's like we pretend now that these things that are actual issues that you would ultimately not want to live with are just part of it and it's okay and you can just be. It's like, no, do a little work to kind of fix that part of you. You're not going to completely fix it. The people you're with hopefully will be sympathetic, but like we can't just be like, yeah, you say you have this, so I guess whatever, whatever you say goes.
I feel like we're almost kind of saying the same thing. It's like you kind of have to meet somewhere in the middle
Hmm.
because obviously you have to take mental health seriously. Like obviously.
Hmm.
Um but at the same time, when is it going too far? Maybe
Hmm.
it's dependent on what you're diagnosed with. Like, be like, wait, what do you have? Borderline? You're fine. Or like, like
Yeah.
it's like, oh, do you have anxiety? It's like it's gonna be okay. It's not as big of a deal as you think it is. I don't know. Like the thing that I always think is really hard though is when it's just deep depression, like when people just can't get out of bed, and that's the
Hmm.
hardest thing for people to do. I know so many comedians without naming names where I used to hang out with them all the time, and then all of a sudden they never leave the house. They just kind of do their gig. They come home and they stay home. They don't go out. They don't talk to anybody, and it's like, dude, you're fucking depressed. Like whether
Hmm.
or not you think it's like, no, I just want to go home. I don't want to do anything. And so blah 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 blah. It's like you're gonna look back on your life in like however many years and just think like, shit, I just sat at home for like
Yeah.
40 years. It's like you were in a deep depression. It's like depression is not always this tragic thing. Sometimes people don't even realize like how depressed they are.
Hmm.
Those kinds of things, I think, like the sleepers, those are the kinds of things that you really gotta have a friend in your life that can hopefully say something. I actually recently had a conversation with a friend about this exact thing because I was just like, listen, like every time that we go out, they just before we were about to leave, like they would just cancel or if they did go out when we got there, they would leave and go and come home. And you're like, what? Like the way that you don't want to participate in anything, it's like
Hmm.
that is a form of depression. That's something that we need to take a little bit more seriously. It's not always the loudest person in the room.
Yeah, yeah. It's yeah. No, and I think honestly it's the way technology has changed in the last 20 how quickly it can change. There's a lot of like simple things that I think a lot of people would be better suited for as opposed to say any sort of medicalization or even talk therapy. I mean, some people want talk therapy or need it, some people don't. And I think mainly if there's things you could change, like exercise more, put your phone down more, get out and see human beings and interact with them because we're social creatures. So try to do that as much as you possibly can. And yeah, eat, get good sleep. Those are things that would, I think, cure a lot of people that have these issues, whether
Stop
they're even
drinking.
stop drinking. Yeah,
Stop doing
yeah,
drugs.
yeah. I mean, we can't do everything though. Uh, well, yeah, those 100%. Like those are the amount that your dopamine crashes the next day after drinking is, that's why people call it like anxiety or all the different names for it. But it's literally you were in a looser state, your dopamine was popping, maybe you were a little more like, you feel anxiety, even I do anyway, even if I was like super nice and lovey. It's just you feel like, oh, that's not who I am really all the time. And then your dopamine crashes and you're
Oh
like just
yeah.
feeling like you just feel like shit. But yes, for sure. I mean, obviously no booze would be a cure for a lot of people because that fixes diet almost right away and your sleep.
Oh,
And
the
you throw
sleep.
it,
Yeah, the sleep is a big one. Yeah.
yeah. and then you throw in a little exercise on top of it, and you're good. Put your phone down, read a book instead. I do think that's where a lot of people would end up landing with. And then you could say, okay, now there's the people that are left have things that we need to, they need to figure out, we need to whatever, and society can be a little more, sympathetic towards it. But also, you don't have to, like, it's, as I say, it's not a get out of jail free card. Just because you say you have this thing doesn't mean you get to just treat people like shit. There's, I don't know, maybe, I don't know.
Well, I mean, speaking of because you had mentioned therapy, and I think, okay, so one thing that I think that a lot of people misunderstand about therapy, because whenever I had just a vicious drinking and drug problem during the pandemic because I wasn't working, and I would get super fucked up, and I would just start shit with everyone about nothing. Like, they wouldn't say anything, and I needed a fucking fight. And you're like, okay, I'm gonna go to therapy. It's time to pop the hood, and it's time to figure out, like, what the fuck is going on here, right? And the thing about therapy is you have to want to go to therapy for a problem that you understand is a problem. Because when you contact a therapist, they'll be like, well, why are you seeking treatment? And you essentially have to pitch you're crazy, and they'll take you on as a client or a patient or whatever. But I know people in my life where their life was just not in a really great place. They didn't think that they had a problem. They just started going to therapy. But they're the type of person that has no self-awareness to understand what the actual problem was. It's almost like trying to make somebody go to rehab, but they don't want to get better. They don't think that they have a problem. It's like a lot of people, I think like, oh, I'm just going to go to therapy and I'm going to be like a better person. It's like, but why are you going to therapy? Why do you want to do that? Because you actually have to put in the work and understand, hey, I am the problem. I have the issue, and I need to talk to somebody about it so that they can help me get better. And I think that is a very common misconception with therapy, where people just assume they'll just start doing therapy and boop, it's all better because the therapist will identify the problem.
We're going to get to the bottom of it here. You're going to figure out what my problem is instead of going in with, like, I keep running into this thing in my life where I feel this way and I don't know why, but I know that it's there and I want to get to the bottom of it. Like, like, so you can give like at least a roadmap. Then if you keep a relationship with a therapist for years, you can start, moving to other things, and there's other issues that have bothered me, and then they can help you. And then they just become somebody that they can help you, with like life goals and shit, like, as you're putting your pieces together. But yeah, to just like sit in like, I'm broken, fix me. It's just like, that'd be like somebody coming in with like some physical medical ailment. And I guess that is more the way physical, you go in and go, hey, it hurts when I do this. But it would be like going in and being like, where does it hurt? Everywhere, all the time. I don't know. Like, I just hurt. So why don't you just run every single test you can
100%,
and figure it out? Yeah.
I also think that mental health, like therapy, and if you need like meds and stuff like that, prescriptions, drug medications, I think that should be covered through OHIP. But it doesn't, because mental rhymes with dental, and maybe they're not covering that,
I agree. I think that mental health and dental for sure should be covered, and it's crazy that it's not. That's why this is a big aside, but that's why when people talk about the shitty insurance industry in the States, I think what sucks is that there is no medical universal healthcare in the United States. But I also think that, so which means you have to get insurance. But people always say, well, insurance down there, they deny things that kill people. It's like, no, they do the same thing we do in Canada. We have free healthcare, but what they do in Canada, in the United States, your doctor will pitch you on all the treatments, and they'll be like, this is the one you should do because it's the most expensive, because then the doctor gets a bunch of money. And he's hoping that the fucking insurance company will cover it. But if the insurance company denies it, then the patient goes away thinking they denied me life-saving health care. And it's like, no, they're going to cover the other two options. It's just that most expensive one, they did crunch the numbers on how much you need it based on your case, how much you were. Not all the time. Insurance companies are still fucking terrible. I'm not defending them. But in Canada, you wouldn't even be given that good option. They'd be like, this is what we're doing. And it's because it's the cheapest one. Like, I had two uncles who got esophageal cancer, and one was in Canada and one was in the States. And the guy in the States, my uncle in the States had a better chance of living and almost lived. Now, he had good insurance and they could do some crazy shit, and they did it. And in the end, the esophageal cancer didn't kill him. It was after surgery, recovering. He got an infection in the feeding tube, and his body was so weak from the cancer. That's what ended up doing it, which is a common thing that does happen. But
Oh,
he was given treatment that my other uncle never even got a sniff at in Canada. They were like, you don't get that. Like, we don't do that here. That's insane. The States, that's why the States is the most expensive. But there is a reason why rich people from all over the world go to the States to get healthcare, because there's just like, yep, there's a doctor there. He's the best one. It's going to
yeah.
cost me $250,000, but they'll do it and I can do it. If you have money in the States, it's no problem. Insurance, though, won't cover things that they go, your chances of surviving with it aren't much better than this one. And we're not. And I still think that's gross to value human life that way. But in Canada, they don't even do that for us.
Yeah, I mean our healthcare system is free, but it's not perfect. I've been misdiagnosed so many times. Like I had an appendectomy. I had my appendix removed last year, and after the surgery, they kind of alluded and heavily implied that I didn't need the surgery. They were like, yeah, it was like not good, but like it would have probably become a problem, like a much worse problem down the line. So it was more like preventative. And I was just kind of like, you just cut me open. Like you just ripped out my insides and you're saying that you didn't need to do that? Like
Yeah.
that's insane. Like what do you mean?
Yeah.
Um
I
I've
just had. Oh, sorry. Go ahead. Yeah.
oh no, that yeah.
Well, I just had an issue. I have a varicose vein in my left leg, and it's been getting bigger over the years, and it's something that I want to take care of. But I got a blood clot in it in the early summer, and they misdiagnosed it by the first ultrasound, because there's three types of clots that you can get. You can get deep vein, which is the bad one, and that's like immediate action. There's superficial, which is still something that they'd give you blood thinners for, and then there's varicose. And that one, they don't give blood thinners or anything because it's a useless vein, and it'll go away, and it's a little painful, but you just use some heat compresses and that's about it. They diagnosed it first as superficial, so they put me on blood thinners. Then when they redid it, it didn't do anything. And then they did another ultrasound. They're like, oh yeah, it's varicose. The blood thinners won't actually do anything. Then I went to a specialist to get a look at it. And he's like, yeah, it's a big one. You're going to want to get rid of it. There's the method. He's like, but what he said was, you can either do nothing because it's really not going to cause you any life like threatening injuries. You can do this one version, which is not good. I don't like it. I don't want to do it. I don't think people should do it. And then there's laser, which you can do, but it's not covered by OHIP, and it's $5,000. So that's like I don't know why that system is better than the American system. You know what I mean?
Right.
Like, and
Right.
now that's just my anecdotal thing from this one thing, but there's people who go through that shit all the time in Canada, who you don't necessarily realize that, like, so I have to go through my insurance to see if I can get this, and they could easily deny it. And then why are we better than America in my exact situation right now? That's all.
Right. And then
Yeah.
how did that affect your mental health?
Yeah, right. Yeah, we're way in the weeds here. Honestly, at first I was like, it did actually. If I was like, you're getting fucking old, man, but that's like
Yeah.
a different form of affecting mental health. That's just coming to terms with, all right, you're not a spring chicken anymore. You got this thing that you could deal with for a while, and now it's like, all right, I've been to the doctor a bunch of times the last 6 months, and I don't like that feeling.
Do you know what? I also have, I'm pretty sure it's a varicose vein on my left calf, and it's like all bunched up and like just
Yeah.
fucking gross. And like,
Yeah, it's
if I'm doing,
unsightly. Yeah.
it's extremely unsightly. It almost looks like a string that like is all bunched up like under my skin. And like if I'm on the beach, and it's just like you can see that, like
Mhm.
it's gross. And whenever I'm like at the gym and I'm at like the squat rack, because your veins are popping because the blood circulation, and that fucking thing is just coming to the surface, and you can see its heart beating, and you're like,
Yeah.
I think about this. I'm like, I gotta get rid of this. But you're saying it's $5,000.
Well, the way you can do it, and if it's small, it's not a bad thing. There's actually an injection that you can get that's covered. Mine's too
Oh,
big, and then there's it's called a strip. So they basically like I think it's probably just local anesthesia, and they basically go up your fucking leg with a hook from your foot and pull the fucking thing out. And that's the one he's like, I don't like that one. I was like, yeah, I don't like it either. I'm glad we're on the same page. That sounds fucking horrifying. And then he's like, the injection's too big, because this is the thing. My vein on my left leg. He was like, all right, do you want to hear something interesting? The biggest one of these I've ever seen at my clinic was this, and you beat it by 4 fucking 4 centimeters. You have the record at this clinic now.
Size does matter. That's amazing.
Wow.
Wow.
All right, back to mental health for 1 second, and this will be the last question I'll ask. Do you think, or I think you probably do think this. I was going to just ask the straight up question. Do you think some diagnosis, some mental health diagnoses has become trendy? And I think that goes without saying. So which ones do you think are the most trendy? I think that's more interesting.
The autism spectrum one. That one, everybody's on the spectrum now. That one I think is ridiculous, because my sister, she's actually, this is interesting, she's part of a study right now, and she called me to see if she wanted my advice, to be like, should I do this? Because it's like they can do like a blood test, and they're trying to see if there's a gene that could potentially lead to research that would reveal that it's genetic. Because but the problem with this though is that if she gets this blood test done, it could also reveal if we're genetically predisposed to like Alzheimer's, or like things that could potentially like down the road like kill us. And so she called me being like, do you think that I should do this, blah blah blah. Anyway, I digress. But I think that's the one, because in my family I have people on the spectrum. I have autistic people in my family. When I just hear people like self-diagnosing, I'm like, shut the fuck up. Mm-hmm. It's like I have so many friends that are on the autism spectrum, and like I was raised by somebody on the autism spectrum, and I would grow up and I would say rude shit to people because I thought I was just being honest. But it's because, and then people would be like, whoa, like, why are you? And then I would be like, because I thought I was on the spectrum, like, no, I was raised by somebody on the spectrum. So I just thought that doing and saying those things was just normal,
Right.
And so for me, when I hear that everybody's on the autism, I would say that one is definitely people saying ADD, neurodivergent.
Neurodivergent. I was just going to say neurodivergent, like that on the spectrum. Asperger's, autism fall under the neurodivergent umbrella, right? And so does ADHD, right?
I think they got rid of the Asperger's. I don't think that's a thing anymore.
Okay, all right.
I think I don't know
as I said it, I was like, I think that's done too. But I was like, that's all I knew. Yeah.
There's a whole bunch of them, but the neurodivergent is the one that everybody. It's like, no, you're just an awkward person. Like there is a difference.
Yeah. And I think that's where the self-diagnosis come in, and it's trendy. Those are the two ones that are kind of hard to prove wrong necessarily. You can't really do it in a conversation with somebody. And ADHD is one. It just gets you, just utter shit sometimes, and utter responsibility. Like, you were supposed to do it. Well, my ADHD kicked in and I forgot. And I'm like, okay, I guess, like, that doesn't, the thing still didn't get done. So
exactly.
I guess, like at the end of the day, I feel like it can just be a blanket thing. And then there's some people who definitely have it. But what's crazy about those people who definitely have ADHD is it's like, they're like, hey, did you get that thing done? Yeah, kind of, but I actually did it completely different this way because I fucking stayed up until 4 a.m. I just couldn't, that's where you can really, I think, okay, that person has it, because it's, yeah.
Well, I take like Ritalin and Adderall as like a party drug because it just keeps you up all night. So I know that I don't have it, because when I'm on it, I don't feel like super focused. It really is like taking.
That's how you find it out, right? If you take it, and you go. If you're not focused, you're just like, whoa, like, all right, you don't have the thing. You get to use this as a party drug.
Well, like Michelle Shaughnessy has the best joke about that. I'm gonna like just butcher it, but basically it's like, she went to the doctor and kind of like lied so that she could take the ADD pill pills and, just like so that she would be like so much more productive. But then she noticed how like even and clear she was and how much more productive she was and how much more responsible she was. And she's like, oh shit, like I actually had like ADD. And it's just so funny the way that she says it. But people in comedy, like so many comedians have ADD, and you can always tell which ones. They're usually like either super late, super disorganized. Yeah, like you're saying, just simply forget to do the thing that they're supposed to do, and it's like incredibly important. They can't let you speak. They wait for you. You can tell that they're just waiting for you to finish talking so that they can say what they want to say. It's ADD people are, but also, but going back to like the spectrum, it's like it is a spectrum. It's like, so I think a lot of people seem to think that getting out of jail free card by being like, oh, like I'm on the spectrum and stuff like that. There is cognitive behavioral therapy where you really just have to learn how to deal with that diagnosis. There's no medication that you can take for an autism or a spectrum diagnosis. It's just learning how to live with it and how to adjust to the world around you if you are different. And my nephew goes to a special school, and that's a huge part of his education, is really just the socialized aspect of the world that we have that he doesn't, and he has to learn it. It's there's no meds for it.
No, yeah. It's just the brain works different, and there's a way to educate the brain in a way that makes them go, yeah, look, people are still going to know that you have autism or are on the spectrum, but you're going to be able to fit through and you're going to understand social cues a bit more. And that's all it is, like,
Exactly.
um, well, the one, and we can go soon, but the one thing, because you say you had OCD, right? And that's the
Yeah.
one that for a while I found was the most, people would just say they have it. And I don't think they were actually diagnosing themselves with it, but people don't understand what OCD is. It's not
Yeah.
just like, oh, I have to wear this shirt on this day or something, you know what I mean? Or I always think of this type of thing and I have to do that. It's like, no, the people with OCD, like that's a thing that like you gotta fucking figure that out, right? Like it can be very crippling.
Yeah, so I find that people like, so I have the general anxiety and I have OCD, and like I find it's always women will be like just really organized, and they'll be like, I have OCD. It's like, no baby, that is not what OCD is. Um and or like whenever I'm like bordering on a panic attack, and then somebody's like, oh, like what's wrong, and I'm like, oh, I'm extremely anxious, and they're like, oh yeah, like I get anxious sometimes, like I understand that. It's like everybody gets anxious, that's part of the human experience. It's like my anxiety is like off the charts, like abnormal anxiety about nothing, like going to the grocery store scares the shit out of me. But for me, the OCD, I have oh, checking the locks, that's a big one. That is, I gotta check the locks like 5-6 times before I go to bed. That's a big one. And then also the thing that I get is intrusive thoughts. And so when I was a kid, it started because I used to have a math tutor, and she was the sweetest woman in the world. And she used to like bake cookies, and every time you get like a math question right, like she'd give you a cookie, and she'd have all these games. Like she was just such a sweetheart. And completely off topic, but every time that I went there, she always had the Halifax Comedy Festival on CBC playing in the living room. I don't know why, but I always remember that. I'm like, oh, you're the one person that watches it. Cool. And I was like 8 or 9 whenever I would go to her. And I remember when we would be in the middle of a lesson, I would just think, what would happen if I just punched her in the face? What would happen if I just, because then, that's the worst thing that I could do. But then your brain starts being like, you're going to punch her in the face. You're going to punch her in the face. And then you become aware of your thoughts and then scared of your thoughts. And then you can't focus on anything because you're so scared of what you're going to do. And then you can't stop thinking about it. It's like some people, I mean, Maria Bamford had a joke about being in church and running on the altar and taking a shit on the altar or something. And then this is intrusive thoughts. It's like you have these ridiculous ideas where something is wrong, and then you become afraid of it, but your brain still thinks that you're going to do it. And then you actually believe you're going to do it. And then you become so scared that you don't want to talk to that person. You avoid that person because it's so real.
I actually had a little bit of that when I was a kid. I would think of things, but I don't think it was like diagnosable. I don't think it was bad, but I do remember I just looked at it as like from like a years out, like thinking of different things like that. It's just like, oh, that was just me my brain developing, pushing limits in my own head and thinking things. But like, I remember thinking one time, just got it in my head that my dad was going to kill me for no reason, just a random thing. And it's, like, but I was like, well, he could. What if he does? Or I think he's going to, like it did grow like that. That was the one that I remember the most. And it was just like insane. He was not a violent man. There was no reason to, I just knew it was a possibility. It became in my head something,
And then
this theoretically could happen. Yeah.
Yeah, well, I can't go out on my balcony because I'm like, well, what if I jump off?
Oh,
And
yeah.
like
Yeah.
I can't, and then I'm like, no, I'm going to jump off, so I can't even stand near it because I'm not. But my brain is like, yeah, you are. You're just going to jump off and you're going to kill yourself. And then you become afraid of the balcony. Like just talking about it right now, like my palms are sweating.
Okay,
like,
yeah. See,
that's
the thing. Yeah. Let's calm you down here.
it's just that's OCD. It's like you get something in your mind that's completely irrational and you believe it and then you obsess over it and like
yeah.
I remember like there was this joke on Will and Grace where it was like, oh yeah, my cousin, he has to check the locks like 100 times a day, otherwise like the oceans will dry up. And then Karen's like, wow, it sounds like he has a really important job. Like just...
yeah. I was actually just thinking of an old sitcom as well. There was a joke on Friends where it was like Ross at his like museum and everybody was telling these truths about themselves. And then the last guy's was, I have to turn the light switch on and off 47 times before I leave a room or my family will die.
Yes.
It was like, yeah, there you go. That's that's the one. So it's like this real crippling, intrusive thoughts. It's not all. I like all the towels to go here. Like no, Cheryl, or that's not.
No, yeah, that you're just hyper organized, and that's fine. But OCD people will be like, well, we said that we were going to be here for noon, and it's 12:01. Where were you? You were supposed to be here. Like that's also a thing. Like for me, like time is very important. And like I'll be at like a nightclub and then like my friends will be like, I don't know, 30, 40 minutes late because it's a fucking nightclub. Like who cares? And I'd be like, where were you? Because in my head, it's like we agreed to this time. Like it's like time is a big thing for me as well. But But the treatment for OCD is usually SSRIs, like antidepressants, and also for anxiety. And those always made me feel worse. So I don't take the meds. But what does kind of help is if you take anti-anxiety meds like a Xanax, a clorazepam. I think it was a clorazepam that I wasn't allowed because my boyfriend's a pharmacist and I have an addictive personality. And we were in Mexico at La Farmacia, and you can buy oxys there. And and I was like, oh, I want that because I have anxiety, and he wouldn't let me buy it because it's like so addictive. I think it's a form of an opiate, and he's like, if you were to take that, Kyle, you will get addicted to it, so you can't. So I stay away from all that stuff just because it fucks with my head.
Yeah. Now I just thought of this though. There's also things that people diagnose other people with, and I think the trendiest one for that is diagnosing somebody as either a narcissist or a sociopath. People love to throw, they love to throw that one out there, and it's just like, I just want you to be really well aware that only 5% of the entire human population are sociopaths. Yeah. So if you dated 5 of them, you're fucking maybe just maybe you were part of the problem too. There's no way all 5 of your exes were fucking sociopaths.
That's hilarious because every girlfriend I have in my life after a breakup 100% has said that. Yeah. 100% has said that. And I have said that. So yes, that is so true.
You're a gaslighting sociopath. Like, all right, you need to calm the fucking use of these words down. Like, buddy, this was fun. This is a great chat, man. Anything you're plugging that you want to, people to buy or come see you somewhere?
When is this coming? When is this debuting?
This will be out coming Wednesday. Or no, coming Tuesday. Coming Tuesday.
Okay, anybody that's in the Toronto area, please come to Comedy Bar Bloor, December 20th, 9 p.m. I am headlining my own show. I haven't headlined in like a year and a half, but I decided it's time, baby. And December 20th, Comedy Bar Bloor. Tickets at comedybar.ca. Great lineup. Check it out.
Awesome. All right. Thanks for coming on today, Kyle. I appreciate it.
Yes, thank you for having me.
And follow him on social medias.
At Kyle Brownrig.
At Kyle Brownrig. All right. Thanks for dropping in, buddy.
Thank you for having me.
disagree's a fancy way of saying fuck